Guildford Health Centre, Sally speaking.
But for over a year now, the backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
I don't know what it is. I seem to be waking up on a morning as if I'm drugged.
I've noticed this morning her nose was bleeding. You can see.
Terrible snoring, he can keep you up at night.
Does he actually stop breathing in his sleep?
Oh, yes, he has stopped.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning.
gosh.
Hello, Spike.
Hello, you okay?
You had a happy day already, have we?
Oh, yeah, yeah, exactly. It's always a happy day.
I thought that was all Disney stuff.
Fairy tale.
Okay, hello there. Do come in.
Thank you.
All right, you're looking a bit uncomfortable there?
Yeah.
Come and have a seat.
I had a gentleman go inside of the car on Friday, so we went up to A&E.
Okay.
And they were like, yeah, just keep an eye on it.
Yeah.
And if no better, go back to doctors. And it's not, I just want something to put my head up, if that makes sense.
Mm-hmm. Yeah.
I get a shooting pain, sometimes just going across, but also across my back, about there.
Mm-hmm.
And it's like, I just want some relief, really.
Okay. So were you driving?
I was driving. There was a car parked across Bays that way, and we were driving that way. We almost got past him, and he just didn't see us.
Oh, I see. You were going that way and he pulled out
banged.
into you?
Yeah.
So on the passenger
Yeah.
side? OK.
Yeah.
What sort of speed was it?
Maybe going 10 at a push.
And at the time, did you think you'd been injured?
It was a bit of shock. I got out of the car and it was like, did you not see me? And he was like, no, I didn't, love. Went to Sainsbury's and I thought, oh, my neck started to smart a bit.
Yeah, OK.
So went up to A&E.
OK, you're wearing a seatbelt?
Yeah,
You had a neck restraint on?
Well, the headrest is there, but I'm small, so it's sort of... I'm in the space.
Adjustable, you know.
I know, but I'm in that... It's not quite the bottom, but you know what I mean, don't you, Teak?
She needs like a half rung in between.
Yeah, and then...
I see.
Yeah, it's just that, do I need a booster seat? Don't I need a booster seat? It's one of those sort of things.
All right, OK. OK, just swing around your chest like that. I just want to check your arms and your hands first of all, actually. Do you just show me your hands like that?
Yeah.
OK, don't let me push them together.
I've got arthritis now.
Okay.
Yeah.
Squeeze my finger tight as you can. Down. Don't let me lift your hand up. Sorry about that. All right.
Yeah.
How are things going?
Oh dear, well, during winter, when it's really cold, my fingers tend to be really, really pale. But lately, if it even rains and it's a bit chilly, it tends to be numb. Yeah.
Do you get change of colour with it when it does that?
Yes.
It goes
so
white.
really,
Does it go
really
blue
white.
and
No,
purple
it's
later?
just white.
Just white.
And
just on the
sometimes-
tips of all your fingers,
Yes.
because they feel cool to me now.
Yeah, and
it's
I'm
painful.
yeah, it's really painful.
And it's worse when it's cold and rainy and
That is
winter.
It. Yes, I don't know what's wrong with me.
Do you know what that you don't know? Because I'm sure that the diagnosis is Raynaud syndrome.
Oh.
Have you heard of that before?
No.
Well, it's a common problem affecting around 5% of women. But it's the spasm of the blood vessels as they supply the tips of your fingers, and it's set off by the cold. And it makes them go white, and it makes them be painful, and it's basically everything that you're describing.
Yes, it does happen. I was like, it's something wrong
Shall
with me.
I'm going to write down
and I can have a read about it myself.
Go and have a read, because
Yeah.
you'll see. And there isn't a magic fix, though you can try gloves and keeping your hands warm and things like that, and you can try some medication for it if it gets really bad. Go and have a read about the treatment.
Okay, I will surely do. Oh, dear.
Occasionally, it can be linked to other more generalised illnesses. So if you read up on there, it will tell you what those are. They're much rarer, but they would need another blood test if you had some of these other you know, kind of symptoms or problems, swallowing problems, generalised joint pain.
Okay.
But if it's not doing that and it's just isolated Raynaud, then it doesn't need us to do lots of other tests at this stage, unless it gets really bad, in which case we'll see you again.
Okay, I'll read about it
And then let me know.
I shall let you know. Oh, God. I think you have
Fingers
to see me
crossed,
all the
Janet.
time. I hope you're not tired of seeing me.
No, it's absolutely
Do
fine.
you mind
don't
if I
worry.
check my weight on the...
No, that's fine.
You
Just
sure?
you'll need to tap on it just to turn the scales on.
You know, after I left here, I've been really working hard.
Great. Well, fingers crossed then.
Fingers crossed. So hopefully, let's make 72.
How's that?
That's good because that time it's 72.6. It was 74 the last time I came.
Well, there you go.
So I think it's paid off.
Yeah,
Thank you
well
very much,
done.
Dr.
Nice to
Penny.
see you. Bye.
Okay, just turn your head slightly that way.
Yeah.
That's hurting. You've got to say when it hurts. Mum.
I'm sorry.
Yeah, say out, because I can't see you very well.
Sorry.
Okay, so if I turn it that way.
That's a bit sore there.
Okay, if I turn it the other way.
Sore there.
Okay, but it feels like it's moving reasonably. Actually, you can hold your head in neutral. It's more comfortable to move it that way.
I just need something to, like a constant pillow would be lovely. But I can't seem to find.
Have you tried making your own?
I mean, I put the rabbit that I have in my bag underneath, and that's quite nice because
Yeah,
Feels lovely.
Yeah, that looks like good medical device, doesn't it?
Yeah, I thought so. It's just I just need something soft.
Okay. Just to say what's happened here, I mean, this is a common thing. If people are in a road traffic accident, often you get a little bit of jarring in the muscles, and it can be surprisingly uncomfortable for a day or so.
That's what they said,
maybe even a week or so sometimes, but I don't think it's going to be that long with you. And I don't think there's anything serious damaged here, and I think everything's going to come right. It's sometimes helpful to have an anti-inflammatory gel to rub into the muscles.
I've still got some from before. Am I allowed to use it?
Yes, certainly use that 3 or 4 times a day, actually.
Okay.
That'd be fine. We can't prescribe you a neck collar, and actually we really wouldn't want to.
As stupid as it sounds, I do have a collection of teddy bears. I might just try one of those.
Okay, teddy bear therapy.
Yeah,
that'd be good.
There you go.
Okay, and then I'll give you a sheet with some neck exercises.
Lovely, thank you.
All right?
Yeah, maybe you could sell them in a little sort of shop on the side.
Oh, yeah, we could do that. Everyone needs a teddy bear or two.
You'd buy them all.
I would buy them all.
There we go. Jolly good.
Thank you. Thank you very much.
Okay, now I hope the car gets better soon.
Oh, the car's getting taken away.
Monday.
It's going to be fixed.
Okay.
Thank
Jolly good.
you.
Bye-bye.
Bye.
Hello, I'm liking the wheels.
Yeah.
I tell you what, can I swap? This is killing me, this.
Christopher Collins, please.
Sorry, I couldn't do much. I've been doing it all night, this.
And then you struggled not to worry coming in.
So when you've got to go, you can't go. When you don't want to go, you go a lot.
Have a seat.
I've been terrible all night, I tell you.
Oh, dear. So tell me what's been happening.
Basically, it started in the afternoon, about 3. I was weeing. I couldn't control my urine, and throughout the night from the evenings, it was doing it all the time. Like, you know.
Right, OK.
I weed this morning at about 9 and a lot came out.
OK.
I actually weed into a bucket in my room because I couldn't make it to the toilet.
Oh, dear. Shall we have a little listen? Where does this go? Yeah, fantastic.
Take nice deep breaths through the open mouth.
Can you say 99 for me?
99.
And again?
99.
And again?
99.
Nice deep breaths. Oh, there's some serious static going on.
Nice.
Morning. You have to sit on this one because it's you that's here.
Hi.
She woke up this morning and her heart was racing, like I did like her pulse and things. And then she was led in bed. She was literally just led in my bed and she was like that. She was breathing really fast.
She was kind of panting.
Yeah, as if she'd just been running. And then she had a really bad cough yesterday, didn't you?
Yeah.
Stay here, because he's got to see you.
So yesterday she was coughing.
Coughing a lot. She's normally quite happy, walking around and running around, and then all of a sudden she'll just want to lay down for half an hour.
She had any temperatures at all?
Although she didn't have a temperature, she was sweating, but she was like not hot to touch. So I was like, that's not normal.
And was that at the same time as she was breathing more quickly? All right, Karina, do you think you could come and sit on this chair? What a start. Right, have you seen one of these before? This is called a stethoscope.
It's magic.
I'm going to listen to your heart to start with, which is there. And it is beating.
Shh. He's got to listen to Sissy.
And it's beating nice and regularly at a normal speed at the moment.
Okay.
Now I'm going to have a listen at the back.
It's going now.
So both our heart and our lungs sound completely normal.
Breathe for it.
Let's see what your temperature is now.
Freeze.
So temperature's 36.6.
That's good.
Which is good.
That's what we want.
Yeah. Right, now I want to have a look in your mouth. So I need you to open really wide for me. Can you open a bit wider?
Open as wide as you can.
Don't puke.
Does it feel sore at all in there?
Does it hurt?
Shh, let her listen to the doctor.
Okay. Looks a little bit red.
Okay.
And I can feel some little glands enlarged in her neck. Okay, we're all finished there. You can go back to playing if you'd like. So I think the first thing to say is I don't think there's anything too serious going on. I think probably she is brewing an infection, which explains a lot of the symptoms, and it's here upwards rather than there downwards. Throat looks a bit red. Her breathing going a bit quicker, coinciding with perhaps having a temperature. I think those two things often go hand in hand. Fast breathing or panting, if that's on a sustained basis, if it's not getting better quite quickly, is definitely one of those things that we do take quite seriously because it can be a sign of more serious infection.
Yeah. Really?
OK.
We're finished now.
Wait.
Take care, guys.
You can go now. Say bye. Say thank you. 3, 2.
Am I getting better at cartwheels?
Yeah, please stop. Big pull. Oh. Thank you. Be back for a broken leg
Yeah, no,
later.
I was just thinking that. See you soon, bye.
Good girl.
If you pop up on the bed, can I have a little feel of your tummy? And are you drinking okay?
Yeah.
Yeah. Okay. Okay, can I have a little feel of your tummy?
Yeah.
Yeah.
Could you do the bathroom?
Are you not able to? There we go. Okay. Have you got any pain there at the moment?
No.
No. I'll just have a little gentle feel around, okay?
Okay.
That's fine. You can pop your stuff back on. Do you want me to do the button again?
Please, yeah.
There we go. So you just do your zip, okay? And get up when you're ready. Okay, so this is showing a lot of white cells, some blood and some protein, so that is probably a urine infection. So it's really important to drink as much fluid as you can. Take paracetamol if you get any pains or fevers.
Okay.
Is that okay?
Yeah.
Antibiotics, 1 twice a day for a week.
Okay.
We're treating it as a urine infection, but it's a little bit more unusual to have a urine infection in men, so that's where it's really important for you to come back next week and check that everything's resolved, all right? In fact, if I give you another urine pot to come back with next week, bear with me, I'm just going to get one, all right?
Okay.
As a urinary tract infection in men is more difficult to get, we do worry, could there be something more underlying? Things we'd worry about are blockages or any potential cancer in the bladder. This was the first time I'd met Mr. Collins because he's not my registered patient. I could tell that he suffers with a mental health illness. I can see this from his notes. UTIs and other infections can cause confusion and can make mental health symptoms worse.
This is the truth. I am possessed, not by demons, but a state of telepathic communication. Others may try to use it.
There we go. So if you do another urine sample and bring it back with you when you come next week.
Okay.
All right, there
Thanks
we go.
very much.
So take that to the desk and they'll book that appointment for you.
Okay, thank you.
Okay, let me get the door.
Cheers.
Okay, all the best.
All right, bye.
Bye-bye.
Oh, sorry. Just had a spillage.
OK, what can I do for you?
Open your mouth for doctor, please. Can you see his tonsils?
I can't from here, but I'll have a look in a minute.
Okay,
Yeah,
they
so
are huge.
tonsils remain huge.
And terrible snoring. You can keep you up at night.
So that was the next thing I was going to come
I
to.
can keep anybody up at
The
night.
other
Can
thing,
you?
Yeah.
Are you a great snorer? Can you do an impression of your snoring? You're a great snorer. Fantastic.
sometimes when he's really tired, he'll get to a point where you think he stopped breathing. He'll go in,
Yeah, I was going to ask you about that. So this is at night, you mean?
Yeah,
In at
yeah.
night, yeah.
So he'll go in, and you think, oh my goodness.
Can you do an impression?
So
of
he'll
it?
do. And you're thinking, when's it going to come out? And then he'll just go.
Okay. Does he actually stop breathing in his sleep?
There's been nights when I've actually checked on him thinking, what happened?
Yes.
So yes, he has stopped.
All righty. Can we have a look at you?
And certain things seem to bother him. Certain types of music, not all types.
Okay. I have that
with
problem,
like a
but
heavy
yes.
sort of bass.
Yes, okay.
Can't take it.
Did you hear that Mummy was saying?
No.
So sometimes when you listen to music, you find it a bit difficult. Are you aware of that?
He dances to the music at home.
Does he?
Mine go crazy.
Okay, take your head back slightly. Let's have a look at these amazing tonsils that Mum's been talking about. Good lad. You're absolutely amazing, aren't you? I mean, I think this lad should be seen by ENT. He has got large tonsils. They're not the largest I've seen by some way, but they're quite large enough. So, yeah, it all ties in together. He is, in an old-fashioned parlance, what we call a coryzal child, a child who's got big tonsils, got big adenoids, got slightly nasal sort of speech with it, and it's a syndrome that goes together. And I think ENT should be seeing him and deciding whether his tonsils and adenoids need to be removed. Okay. Is that all right?
Yeah, perfect.
Yeah. Okay.
Anya.
We'll see how it goes. All right, but I will get a referral letter off.
That's brilliant.
Okay, cheerio then.
Thank you.
Bye, folks. Bye-bye.
Bye. Right, come on then. Home.
Oh. I'll have to take phone calls in here. Hello?
Valentine.
Yeah. Okay, I've got to go. I'm going into the doctor's now. Okay. Speak to you tomorrow. Okay, bye-bye. Sorry, that was the...
That's all right. Hello.
Hello. Long time.
Yeah. How's it going?
A bit up and down.
All right, come on. Okay.
Some positives, some negatives. Okay.
All right. So, what can I do for you today?
Well, I ask you if you can help. My last Laurel's appointment, I talked about the gender recognition certificate. I need a supportive letter, one from my GP. I think it's just basically needing to know that I've been presenting myself consistently as female.
As I've said to you before, I am going to be quite happy that this is something that you've presented to me consistently, so you don't need to worry about me signing it when the time comes. All right?
Yeah.
So,
for a panel,
application for gender recognition certificate, OK?
So that's that. There's another thing. I talked to him about operations.
A breast construction.
Yeah, OK. She gave me two things that she required from me. One was to lose weight, and I've actually lost quite a bit of weight. I've reached the goal where she requested what I need, because no surgeon will touch me or go ahead with anything unless they can verify that I'm physically fit for it. you know, physically, not mentally, but physically fit.
Okay.
And
There'll
I'm
be no
happy to-
reason why you can't physically have an operation. Mentally, that's more a different thing, you know, whether it's the right time psychologically for you. That's more for the Laurels to consider.
My question of mental health, I'm not questioning about my gender and the dysphoria, and, you know, that part of it, like, I'm quite stable in.
Well, I think as
you
long
know.
as the Laurels agree with that, then that's probably going to be fine.
The question is over the mental
Why
state
don't
of all the other
Why don't you
things.
talk to them?
So if I discuss the mental side of it with them,
Yeah,
and then go back to, then have the appointment.
Yeah, and then if
you
I
know.
get a letter, there won't be a problem.
So to say physically, I am fit physically.
Okay. All right, Valentine.
Yeah.
I'm with you all the way on that.
Okay then.
Okay.
I'll get yeah, great.
Okay, doke.
Thank you
All
so
right,
much.
well,
thank you.
That's all right. Okay.
Yeah, okay, thank
All
you.
right then. See ya.
Okay, thank you.
Bye bye.
What can I do for you, Julie? You need a new name badge. Why? Yes, going to order you one. It's got to be yellow.
They got to be white. But then I had mine recently because they'd ordered it and they spelt Jackie wrong. Don't do the IE.
Hayley Beattie, please. Hello there. I wasn't hiding. Coming in. Thanks for waiting. I was having a little look at your notes.
That's okay.
Have a seat. Right, what can I do for you?
I've been having episodes, like last night, for instance, like I'm final day, my normal happy self, and then something just switches and I just cry, I can't seem to lift myself up and I can't find a reason for why I've just changed either. Like, nothing happened in the day yesterday. I'm having ongoing problems with my neighbours, which has been going on for a minute, and I'm trying to move. I sort of put my Cody to bed, and then it just went down from there.
I've had ingrown toenails for quite some time.
Right.
And I have been cutting them out myself.
What do you mean cutting them out?
Trying to cut them as good as I can.
Because I'm on my feet a day at work,
Yeah.
sometimes it is really uncomfortable. I just want to put my feet in cold water.
So as I press down here, is it okay there?
Have you ever had one of these before?
Yeah, and back from Pakistan, I have a both nails.
Oh,
They
yes.
took them off.
You don't want that to go up there. That's horrible, isn't it?
Usually they're like really like pussy and like
I think it's because earlier I ran on the field and I felt something hurt on my foot and it popped.
What have you done?
Okay, so I noticed that my big toenail was getting a bit thicker, so starting to grow extra layers.
Okay.
And I noticed that on the other big toenail, on the other foot, and they've continued to grow layers.
When you see them, you understand.
Okay, so...
It's got really thick, hasn't it?
Yes, but it's very loose.
Let's have a look at your other one then. The nail is obviously very thickened. Oh gosh, yeah, you have got layers, haven't you? Yeah. That's strange.
Yeah, no, curiously, my wife has very thick toenails. We think it's possibly a hereditary thing.
How loose are they?
The first top layer sounds very hollow.
So, I mean, I think that these layers is pretty much dead nail. I think what's happening is that you've got a chronic sort of detachment of your toenail for whatever reason, and then I think it's basically just not coming off fully, so then it's just attaching to the one underneath each time. The only thing you're going to be able to do is go and see a podiatrist.
Right.
Really, and then they'll be able to treat them and sort it. I think the main thing is going to be to file them down.
I think it's an angle grinder time, isn't it?
There's no infection or anything like that, so it's not anything that's causing a risk to your toe or anything like that. Can I take a photo? Then I know for future reference if I ever get any 16-year-olds with the same toenail problem in everything. It's quite interesting. Layers, isn't it? Like an onion.
Yes, it is like an onion. I didn't think they'd be having a photo shoot today.
There we go. A podiatrist will be able to sort them out, and then once they've sorted them, it's going to be a case of just keeping them filed down so that they don't get really thick.
Oh,
Thanks for your time.
Your help.
You're the only one with weird toes. My friend has toes that look like thumbs.
Oh, wow.
They're really weird. Who's teaser? See you later.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning because I can't settle, and but I had no explanation as to why. It just switched like that.
So how long has it been like that for?
About 4 or 5 weeks now.
And you've suffered with anxiety in the past, haven't you? Are you on tablets for it?
I'm on sertraline, yeah.
100 milligrams. And how long have you been on that dose for?
Quite a while now.
And what's happening with you at home at the moment?
I'm having ongoing problems with my neighbours, general intimidation. You know, I have to walk through them every day because they sit outside. I've been on to the council, the housing officer, so I'm hoping to be moved soon. So I'm just trying to keep myself to myself. I'm walking through them now because at the beginning I was shutting myself in and I didn't want to come in, but now I kind of hold my head high and I just walk out. I had complaints, I've got cameras, they put cameras up, and I've got one that faces up the drive, which is fine, but now I've got one that goes towards my front door. So it's like I have to live like I'm in Big Brother.
Right. And is it just you and your...
Just me and my son, yeah.
And how old's your son?
He's 3, coming up 4.
Any nasty thoughts about harming yourself at all?
No. In the past, in 2009, I did go through a stage of that, but I think my son keeps my head above that level.
How would you feel about trying some counselling or talking therapies?
Yeah, I did get in contact with one, but they were supposed to phone me back and they never did. I'm not very good on the phone, so I'm not very good at...
OK. Maybe it's something to look at again.
Yeah.
Because I think you're going through a lot, you know, with your neighbours and, you know, single mum as well.
Yeah.
You know, it's hard. So you can email them. OK, you don't have to ring them.
Yeah,
so that's the first step. You could do that.
Yeah.
Then they do like to chat on the phone, the next step. OK, but you can give a specified time and, you know, when you're at home safe and maybe you can listen and that sort of thing.
OK, yeah.
And so you try and contact the Bristol Wellbeing Therapies. Either come back and see me, Dr Ramshaw, or your own doctor in, I'd say, 2 to 3 weeks.
OK, yeah.
Is that OK?
Lovely, that's brilliant. Thank you.
Nice to see you.
And you.
OK.
Thank you.
Bye-bye.
Bye.
Can I help?
Hi. See a question. Do you do nail cutting here? Toenail cutting?
We don't.
Age UK, look on...
Oh, Age UK. Bear with me 1 second.
Oh, that's all right.
Find the number for you.
That's one thing I can't do. I get the clippers and like, oh, God.
Aha, so it says 15 pounds.
No, I think I'll struggle on, don't you?
OK.
Right, I don't know what it is. I seem to be waking up on a morning as if I'm drugged. And I do tend to get giddy. I seem to lose my balance rather a lot. Luckily, I can hang on to things as well. But if I get up too quick, obviously. I've got, I think, I don't know, high blood pressure. I think it's low blood pressure.
And how long have you been feeling a bit dizzy?
A couple of months, to be quite honest with you.
OK.
I'm 76 now. So it frightens me a bit. And I didn't know whether I was taking too many tablets. So I feel as though I'm taking too many tablets because I'm taking either 14 or 15 on a morning.
So if you get up to move, is that when you feel a bit dizzy, or is it when sitting still?
I go to get up and everything's disorientated.
OK.
I know where I am.
Yes.
But it's just getting from point A to point B.
Things. OK.
You know, and it tends to frighten me. I think I'm going to faint over in a minute, you know.
Once you've sat down, if you're sitting down, do you feel all right?
Fine.
OK, so it tends to be when you've got up to try and move around that you can't, that you're a bit unbalanced. Do you want to slip your jacket off for me so I can just have a listen? Lovely.
OK.
Yep, that's perfect. OK, let's just have a listen. You can breathe normally. I'm just listening into your heart for now. That all sounds fine. Let's check your blood pressure.
OK. As you can see what the tablets are doing.
Yeah. To be careful with you, don't we? You've got delicate skin.
Yeah.
138/71. That's OK, but maybe it's a little bit low for you at the moment. Yeah, so you've had high blood pressure, a regular heartbeat, and a stroke in the past, and you've got the lungs. OK. Yeah. You're on perindopril, and that lowers blood pressure.
I did 2 milligrams.
You're on 8.
She put me up to 8 because she said the arteries are too narrow.
Yeah.
And she wanted to open the arteries to allow the blood to go through a bit quicker.
Yes.
So she said, I'm going to up it to 8.
That was about a month ago.
Yeah.
I just wonder whether that's what's made you feel a bit unsteady. Whether just that increase in dose, because that would fit with you feeling like this for about a month. Yes. I'm going to get you back down on the 4, just to try to see whether that makes a difference to this dizziness.
Yeah. How long is it going to be before I start noticing, if there is going to be anything, a difference?
A week? Yeah.
That's brilliant. Thank you very much. Thank you.
Is that okay?
Yep.
Great.
Have a good day.
Thank you. Bye-bye.
Thank you, love, for seeing me. Thank you.
OK, come and have a seat. What can I do for you?
Well, I've got like these random spots that come in and out before because they were like they thought they were acne, but they seem to be like spreading like up here. They're in my eyes and stuff. But they're in my ears and they're really like itchy.
All right, and how long have you had them for now?
Maybe about 3 weeks. They just started on my arms, but I don't know if they're the same thing. But they're like, I've got tiny little ones in places that you can just feel like digging in, like.
Okay.
Almost my mouth and stuff, so I don't know.
So it's itchy spots, you've had them 3 weeks, and they're getting worse.
Yeah,
and
we've
then
not
tried any particular treatment for them so
No,
far?
it was just cream. Like they said to get some, they thought it was acne to get acne cream, so I just got like went to the pharmacist. Like I've been
Should we look at
scratching
your
here.
arm first of all?
Yeah,
I'll probably look under a bit of magnification.
No, that's fine. And then some of them are like really, really tiny ones.
Okay, let's look at this eye. Okay, what's your general health like?
Okay, I think.
Okay. Some of these you've scratched, I think. Is that right? Would that be right? Is that one not scratched and that one not scratched? All right. Where else have you got some good ones to look at?
Do you want to see my back?
Yes, that's sometimes helpful, actually.
And my armpits are really itchy at the moment, so I don't know if they're in there.
Okay.
Sorry, it's quite personal.
Okay, let me just have a look at this. Again, I'm just going to look under magnification.
Yeah, no, that's fine. I think the more I touch them, the more itchy they are.
I think that's often the case. So when I look under magnification, what we see is a little red spot, often scratched, often with a bit of inflammation around the spot. And they look like septic spots. In fact, a lot of them look like something called folliculitis, which is where the hair follicles get inflamed and the bacteria have got sort of scratched into the hair follicles.
Around my hair on my legs.
So this is a little bit tentative of what I'm going to say, but quite a lot of these spots would do for what's called folliculitis, little bacterial infections, so they're hair follicles which have got infected with staphylococcal skin bacteria. Okay, don't look fine. We've all got those. We've all got them. It's just some people they cause trouble and some we don't. Okay. I suspect you've scratched your legs. Maybe you've been a bit hot and sweaty. You scratched somewhere else and you've just spread the germs around, and this thing has.
Is it contagious?
Not desperately so. I won't say zero contagious, but not desperately so. Okay. So these are the things I'm going to recommend, okay? Firstly, I'd like to recommend that you cut your fingernails as short as you can, at least once a week, and file them down most days, so that should you be scratching, you can't be breaking the surface of the skin. Try and train yourself not to scratch these spots.
Just leave them.
Don't leave them, or if you can't bear it, just slap them, because slapping will relieve an itch a bit. Thirdly, I suggest we give you a course of antibiotics, and we'll do at least a 2-week course. I'll give you a small tube of a cream with an antibiotic in it that you can use on particularly itchy spots if they're really driving you crazy. All right? Then I think it would be prudent to get blood tests done, and particularly interesting to check for diabetes or getting towards diabetes.
No, that's fine.
Because that can predispose to this sort of thing. I hope that things will turn the corner with that. Obviously, if they don't, we'll see you back.
All
right?
I'll wait back. Thank you ever so much.
Cheerio then. Bye-bye.
Thank you.
The printer's not working. Do you know what it is? Oh, that's all you had to do? Oh, what's going on here? Private prescription. I don't know why it's coming out 100 times.
Right, I'll put that up now and it should work.
That is lovely, thank you.
If it was a nice, easy one, I could do that.
Come and have a seat.
Breathing problems again.
Okay.
I think I've got another chest infection coming.
Okay.
I've fed up with it now. There's nothing, never gets to the bottom of anything.
Okay.
I've had x-rays, there's a shadow, it's decreasing, it's increasing, it's decreasing.
Chest has been getting tighter and tighter, and now it's just like someone's permanently got me in a sort of bear hug sort of thing, finding it really hard to breathe.
Fine, okay. Any fever?
No.
Or are you bringing up any phlegm?
Green mucus.
Okay.
Whenever I cough, I bring up phlegm.
Are you a smoker?
Yes.
Yeah, okay.
I've had the cough for a year.
Okay.
Over a year.
Have you been feeling hot? Yeah.
Yeah, sweaty. It's just like someone's just permanently squeezing on my chest.
Yeah.
It's all across here. I've always been worried about lung cancer because I smoke that.
Yes.
And the pain's getting worse and worse as the years go on. For over a year now, I've been backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
And where do you work? What do you do?
I work at a bar.
Long hours and things?
Yeah, that's what I've been doing, so I've just been getting really run down.
No, I work in kitchens.
What do you do in kitchens?
I'm a chef. So,
And where do you work?
I work in 3 places.
It's nice and relaxing. And what do you do?
Transport planning.
Right, transport planning. I think Bristol could do with a bit of transport planning.
You used to work in an oil rig, is that right?
Oil tankers.
Oil tankers.
It's been about 20 years ago, yeah.
How are you today? You all right?
Yeah, all right. I've been on my knees all day replacing floors. It's a dirty job, but someone's got to do it.
Indeed.
I used to be in the lifting game years ago. Removals.
There you go then.
Domestic and industrial.
The perfect job for you then.
Yeah.
Come on in.
Where would you like me to place it?
Let's go down this then, shall we? Then
Okay.
you can sit on that chair.
Yep, I'll do that. Is that right the way round or
It's the other way round, but
Oh,
never
I
mind.
should know that anyway, shouldn't I?
You should do after all
Yeah, I
this
should
time,
do,
shouldn't
yeah.
you?
I'm a little bit scrambled at the moment.
How's the leg?
Well, I haven't had any distress with it, I've got to admit.
Right.
But maybe I didn't have them up. But that's looking better, though, isn't it? I think. It's looking a lot better than it was.
Yeah.
I think being on the move all through the day has helped it out. It's
Yeah, it's getting there, isn't it?
it's a silver lining, like, you know.
Right, yeah.
Yeah, lovely.
Let's have a look at this then. So that's good, isn't it? Good. There we go then.
But I would think, what would you reckon, another week or two on this one?
Yeah, another week or two.
Well, all I can say to you is have a nice end to the week, have a nice weekend.
And you, yeah?
Yeah, thank you very much.
Okay, take care, bye-bye.
Take care, thank you, bye-bye.
It's not located down this side like it usually is. It's all across the top half of my chest here.
The pain that you're getting now?
Yeah.
Okay, yeah, okay. Are you working?
I'm a plasterer.
You're a plasterer, okay. Have we wondered about whether your work has anything to do with your chest?
I've changed jobs. I was doing things like plasterers. I wear a mask, I wear goggles.
Yeah.
Except for the other day when I went to the hospital to get plaster washed out my eye, but yeah. So I changed from building sites to private little home jobs now, working for myself. It's not so dusty, so.
And you've had a chest X-ray?
I've had 3 or 4.
Yeah.
I have to have regular ones.
Okay. The X-ray I'm looking at, they've said that there are prominent markings in the left lung base again.
Yeah.
Respiratory physician opinion could be helpful. So have you been to the hospital to be seen?
I've had no appointments for nothing.
Okay, all right. And have we done any breathing tests with you here?
I can blow perfectly all right on these tubes. Apparently I've got brilliant.
And have we ever got you to go into the treatment room to do some breathing
No.
tests? Okay, fine. That might be just useful to do as well. And you've had blood tests?
I've had blood tests, I've had this, that and the other done.
Let me just do the usual sort of
Usual
check
stuff,
your
it all
oxygen
comes
level.
back properly and clear.
Oxygen levels are good, 99%, so that's good.
Always comes back the same.
87. Yeah. Do you want to, if you were to lift up for me, that's great. And just take some deep breaths. Just lean forward for me. And take some deep breaths again. Okay. I can't hear anything down here different. I'll give you some antibiotics today if that you're bringing up mucky phlegm and you're feeling unwell. Any weight loss?
Weight gain?
Wait, have you been gaining weight? Okay, okay. It sounds like we ought to be doing some more blood tests and some breathing tests and making a referral to the hospital for them to take a look at you.
Probably my lungs full of smoke.
Smoking?
Yeah.
Are you ever going to stop?
I tried one of those vape pens and my chest got worse, not better.
Okay. I mean, ultimately, your chest would improve. You know, it's better for your health overall to stop smoking.
Yeah.
Sometimes there is a really difficult bit when people first stop smoking. So there are...
I feel sick.
And that's probably the lack of nicotine, because it's the nicotine that's addictive.
Oh, yeah, I want to stop smoking. Obviously, I don't want to be a smoker. I don't want to kill myself, do I? I've got young kids. So.
Yeah, we've got people trained up here to support people to stop smoking. We know it's hard to do.
I'm willing to give anything a go that makes me feel better.
And
what about the hospital?
I'll make a note to myself now to make a referral for you.
Thank you very much.
All right.
Thank you.
OK. Bye-bye then.
Bye-bye.
So if you say newly nailed, it's there now.
Oh, brilliant. OK, thanks, Cliff. Thanks for that. Cheers. Tanya's back on the phone, so you're all right.
Sorry, are you talking to me, Nigel? Just
I was trying to.
chewing a brick.
Hello there. I'm Dr. Bolam.
Yeah, hi.
And this is Harmen.
Harmeen.
Harmeen.
Yes.
Sorry. OK. OK. And she's just 4 weeks old.
Yeah.
And she's your third baby, is that right?
Yeah, she is. I've noticed this morning her nose was bleeding.
OK.
You can see this.
Oh, yeah.
This is bleeding this morning. But whenever she sneezes,
I see.
you can see it here.
OK. Are you breastfeeding her?
Yes.
OK. And is that going all right now?
Yeah.
I'll have a proper look at her in a minute. But how does she seem to you now? She seems well, does she?
She seems okay, but I just worried about the bleeding.
Yes. Okay.
Yeah.
There's no rash on her.
Yeah. Her body was full of spots about 2 weeks ago.
And that's, in fact, getting better then.
Yeah,
is it?
yes.
Well, I'll tell you what, if you pop her on the bed and stay up there with her, and then we'll do a temperature and have a look in her nose and such like. OK? All right? Hello? All right? You doing some puzzles there? Very good. All right. OK. Right then, let's have a look at you then, madam. Hello? Hello, what's going on? What's going on? It's OK, so she's no temperature now. All right? It's 36.9. OK, right then. Is the blood only coming out of that right nostril?
I think so.
Like it is,
Yeah,
isn't it?
yeah.
Yeah, OK. Hello. There's just a little sore area on the edge of her nostril. All right?
Okay.
OK. I'm not worried about that. OK. All right, she's well. She's no temperature. There's no worrying rash. She's feeding OK. She looks great. All right?
Anything I can give it to her?
I would just keep it clean. OK? Maybe boil some water, let it cool, put a little bit of salt on it and just, bathe it a couple of times a day with some cotton wool. Okay. Is that all right?
Yeah, that's fine.
She's fine. Congratulations.
Thank you.
So you've got a boy?
And 2 girls.
And 2 girls.
Yeah.
OK. And you the biggest? How old are you? You're about to be 10? OK.
10 days.
Oh, 10 in 10 days. OK. Cool. And how old's your other sister? 8. OK, so Mum's had a bit of a gap there.
Yeah.
OK, so you're remembering how to do it.
I totally forgot everything.
Yeah. It's coming back though, is it?
Yeah.
OK, all right, so keep an eye on that. Obviously, if anything seems to get worse or she goes off her feeds or you're in any way concerned, you bring her back.
Thank you so much.
All right, no, that's my pleasure. Have a good birthday.
Thank you. Bye.
All right, bye-bye now. Bye-bye.
Thanks very much.
Good news.
I shall see you later if you're there.
Absolutely.
Thank you so much.
Good, nice to see you.
Thanks a lot.
Cheers,
Bye-bye.
bye. All right, not a problem. OK, all right. Thank you. Oh.
Take care.
All right.
See you later.
Cheers.
OK. Come on then. Are you going to stay with me?
Come
See all my patients? Bye-bye.
Bye-bye.